Welcome to our channel, HASHMICLINICS.
All right, colleagues, welcome. We're going to start our deep dive into APIS Mellifica with this quote from Dr. M.L. Tyler. And really, it's the perfect place to start because it captures the absolute core of the remedy. If you remember nothing else, remember this. So let's get right into it. Welcome to our clinical masterclass on APIS, the incredibly powerful remedy that we derive from the honeybee.
Here's the path we're going to take to build a really solid clinical picture. We'll start with the very essence of APIS, then build out the constitutional picture, pinpoint its keynote symptoms, and then we'll get into its causes, its comparisons with other remedies, and finish with some indispensable prescribing pearls.
So first things first, to truly understand APIS, you have to go right to the source, the bee sting itself. The entire remedy picture unfolds from there.
At its heart, the core disturbance of APIS is the state of acute inflammation. You get that swelling, that edema, a distinct red, rosy color, and those unmistakable, sharp, burning, stinging pains. It's all about serious inflammation with effusion. Honestly, if you can just think of it as a systemic bee sting, you'll always have a firm grasp on this remedy.
Okay, so with that core pathology in mind, we can now start to build out the full constitutional picture. Let's see how that signature of the sting plays out in the mental and emotional life of what we often call the busy bee patient.
Now, what's really fascinating here is the polarity you see in the mental state. It's completely contradictory. On one hand, you have that classic busy bee. They're restless, fidgety, irritable, can't sit still. But on the other hand, that same patient can swing into this profound state of apathy, indifference, even stupor. This alternation, well, that's a powerful characteristic.
And here is where we connect those intense emotional drivers, like an almost unbelievable jealousy or rage, to the physical generals you just can't miss. Two pillars of any APIS prescription are right here: a profound, almost total lack of thirst, even during a high fever, and an absolute undeniable aggravation from any form of heat. All right, now let's do a survey of the remedy's action right from head to toe. We're going to pinpoint those keynote symptoms that really make APIS an unmistakable choice when you see it in the clinic.
When an APIS patient walks into your clinic, one of the first things you might notice is this classic, puffy, bag-like swelling under the eyes. Sometimes the upper lids hang down like little sacs of water. The whole picture just screams of that localized, puffy inflammation we see from a sting.
And this swelling, this edema, it becomes incredibly visible in the throat. I mean, the uvula hanging there like a little translucent bag of water, that is practically a pathognomonic sign for APIS, especially in really severe throat conditions like diphtheria.
On the skin, you see that exact same signature of the sting, just writ large. It's an erysipelosis inflammation with a ton of edema. And pay attention to the progression. It often moves from right to left, but you still have those core components: the burning, the stinging, and that rosy hue.
The urinary sphere is absolutely critical. So listen for this combination. You have edema, you have thirstlessness, and then you have scanty or suppressed urine. When you see that trio, APIS has to be at the top of your list. It's a powerful guide, especially in things like post-scarlet null dropsy, swelling after scarlet fever, or acute nephritis. APIS also has a really strong affinity for the right ovary. You see it indicated in ovaritis and cystic growths, always with those characteristic stinging pains and a real sensitivity to any kind of pressure.
So we know what it looks like. Now let's talk about what actually brings on an apple state. Understanding these triggers and where to apply the remedy is absolutely crucial for prescribing successfully.
It often boils down to one of two main triggers. Either it's an intense emotional shock, we're talking jealousy, rage, fright, or it's the suppression of a skin eruption, which then drives that whole pathology from the surface deep into the system, causing serious internal complaints.
So you can see APIS is just a powerhouse for those acute inflammatory crises that are marked by rapid, violent swelling. But it's not just an acute remedy. It also has a deep, deep action on chronic conditions, particularly in the female sphere and in those long-standing dropsical states.
Now, to really lock in your prescription and be confident about it, you have to master the modalities and comparisons. These details are what separate a good prescription from a great one.
And with APIS, the modalities are just absolute. They're unwavering. The aggravation from heat in any form and the very distinct, clear relief from cold applications, these are non-negotiable keynotes. If you don't have them, you might want to reconsider your remedy choice. Differentiating APIS from remedies that can look similar is absolutely essential. So let's just walk through this chart. Use it to compare the character of the swelling, the level of thirst, and the primary modalities to avoid making a clinical error. And pay special attention to that inimical relationship with Rus-Tox. Giving them close together can really confuse the case, as their actions can be quite antagonistic. Okay, to wrap this all up, let's distill this knowledge down into some actionable clinical tips, some real pearls of wisdom you can take with you and apply immediately in your practice.
Keep these pearls in your back pocket. That increased flow of urine after you give the remedy, that is just a beautiful clinical sign that you're on the right track. And please don't forget that inimical relationship with Rus-Tox. It's a critical piece of practical knowledge that will keep your patients safe. And of course, the simple memory aid. Just think BEE, burning, edema, effusion.
I want to leave you with this one very serious thought. The sudden, shrill, piercing scream you sometimes hear from a child in a state of hydrocephalus or meningitis, the cri encephalique. That is an urgent call for APIS, and recognizing it in time, well, that can be life-saving.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.